Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session or lecture we will be starting with the hospital management course for CUPG PGCUT to 2025. So in this lecture we will be starting with the first topic, which comes under the module or the unit of health and disease concepts. So health and disease concepts is the first unit or module for the syllabus of this PGCUT of hospital management. So we will be starting with the first topic that comes under this module of health and disease concept. So as we can see, the first topic is dimensions and determinants of health. Okay, so let's begin. So before moving on to the dimensions and determinants, firstly we need to have a brief idea or a basic overview of what do we mean by health. Okay, so let's see what they're saying over here. So health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Health is a dynamic state of complete physical, mental, social and spiritual well-being, and not merely the absence of disease or infirmity. So basically they are stating in both these sentences, they are more or less stating the same thing, that health means like how will we say that a person is healthy, or how will we say that the person is having a good health? It will not only encompass his or her physical health, but also the mental health, the social health and the spiritual health. Okay, spiritual health as in how that person is connected with the the spiritual beliefs of humankind or mankind, not only necessarily religious beliefs, but also the the basic humanitarian traits, okay, or the basic humanitarian behaviors or attitudes that should be there. And the person should also be mentally healthy, the person should be free of any kind of mental illness or mental disorder. And obviously the physical health should also be on the positive ground. Okay, means he or she should not suffer from any kind of disease. Okay, disease as in, again, it can be a physical disease, or it can be a mental disease. Okay. Okay, now coming to the dimensions of health. So when we talk about the dimensions of health, the first or the most important dimension will be the physical health. Okay, so let's see what they're saying over here. So physical health means that an individual should be physically fit. Body organs are physically fit means not only that person is free from any disease or free from any pathological condition, but also that person should practice minimum amount of physical activity on a daily basis, which is very important nowadays. Like many of us are suffering from besides increased stress levels and different mental manifestations of stress, anxiety, depression, frustration. Besides that, we are also suffering from the side effects. Basically these are the side effects of a sedentary lifestyle. Okay, sedentary lifestyle means when we are continuously sitting for at a stretch for like 6 to 7 hours in the with our laptop on the table, or our work desk in the office, and we are doing, and like as soon as our work time is over or work period is over, we are either going off to the bed to sleep, or maybe we are just lying down and watching some series or whatever. So there is no physical activity. Okay, so each and every one of us, okay, each and every adult and also the adolescents, the teenagers, we should have a minimum amount of physical activity on a daily basis. Okay, whether it's doing the normal household chores, whether it's a bit of morning walk or evening walk or jogging or yoga or zumba, any kind, dancing, swimming, gymming, any kind of physical exercise should be present in our daily lifestyle. Okay, so physically fit में ये सब कुछ आ जाएगा. So body organs are structurally and functionally in a normal state, and there is a perfect coordination between the organ and systems, which is known as homeostasis. Okay, homeostasis is basically the balance inside our body, and the balance which keeps our body in a steady state or in a stable state. That is what is homeostasis. Okay, absence from sickness or disease does not mean that the person is healthy. Apart from disease, a healthy person should not have any physical handicap like crippled legs or arms or defective eyes. Okay, so जस्ट बिकॉज एक इंसान में कोई बीमारी नहीं दिख रहा है, apparently कोई बीमारी नहीं दिख रहा है, उसका मतलब वो इंसान एकदम फिजिकली फिट है, ऐसा नहीं है. ओके, सो फिजिकल फिटनेस इज अ what to say is a is a broader aspect, or it's a broader perspective. Okay, it includes hygiene of different parts of the body such as skin, hair, teeth, eyes, ears, hands, feet, rest, and sleep. Sleep again is very important. Okay, again I would come back to the same thing, that nowadays due to increased work pressure, or a change in the lifestyle, a change in the daily daily activities that we do, uh, our sleep cycle is also very much hampered. Okay, because either we are working late in the night, or we are watching some series, or we are hooked with our phones to Facebook or Instagram. So as a result of which our sleep cycle is getting hampered, our sleep cycle is getting disturbed. Okay, and the two main hormones that are responsible for a sleep cycle is serotonin and dopamine. The levels of those hormones are also getting fluctuated. Okay, and if the sleep cycle is not proper, if the because I hope you all know that the minimum amount of sleep that an adult deserves, or an adult needs, body of an adult needs, is around 7 to 8 hours per day, per 24 hours. Okay, so if that 7 to 8 hours is not completed, if that 7 to 8 hours is not met, then in that case, these the levels of these hormones like serotonin and dopamine, they get dropped, or they either become very much high, or they become very much low. And these hormones are again directly and indirectly responsible for regulating our mood. Okay, these are also known as mood regulators. So as a result of this fluctuation in the levels of these hormones, our mood is also affected, and we are suffering from mood swings, mood disorders. So these are again signs of physical unfitness, or signs of being physically unfit. Okay, and also hygiene means cleanliness. Okay, we should clean. It's not that ki roz naha rahe hain matlab ekdam mein physically I am clean. No, we need to give separate importance to each and every part of our bodies as far as hygiene is concerned. Okay, physical health means that an individual should be free from sickness and disease, including communicable and non-communicable diseases, and there should not be any deformity of the body. Okay, any deformity means जो यहाँ पे बोला है any physically handicappedness. Now see, physically handicappedness, a person can be born a handicapped also. Okay, now that is obviously he's not his or her fault, but in some cases the physical handicapness can be occurred also, can be acquired also. It might be due to some accident, it might be due to it can be a professional hazard also. So in those cases also, that person will be, whether it's by birth or it's acquired in the lifetime, that person will not be considered as physically fit, for obvious reasons. Okay, and talking about communicable and non-communicable diseases, communicable diseases means those diseases which are highly contagious, or rather the infectious diseases. Okay, which are easily like transmitted from one person to the other by close physical contact. Okay, so those will be the communicable diseases, and the non-communicable diseases are those which are not like example of communicable diseases will be, obviously nowadays recently we suffered from the COVID pandemic, so obviously COVID-19 will be an example of a communicable disease. Then we have HIV. Okay, we have hepatitis B. So these are some of the communicable diseases. And non-communicable diseases means which will not be transmitted from one person to other, only by physical contact. Okay, say for example typhoid, jaundice, okay, cholera, uh, dengue. These are not, dengue again is to some extent it is considered as a communicable disease, but most of these diseases are non-communicable diseases. So whether that person is suffering from a communicable disease or a non-communicable disease, irrespective of what type of disease it is, if the person is suffering from any type of disease, okay, again not only physical disease, but here since we are talking only about physical health, so I will be talking about physical disease only. So any type of disease, whether it's communicable or non-communicable, then that person will not be considered to be physically fit or physically healthy. Okay, so that was the first dimension of health, that is physical health. Now moving on to the second dimension of health, that is mental health. So mental health will be defined as the ability of the individual to make personal and social adjustments. These adjustments are concerned with one's daily life in relation to others, as there is saying that healthy mind resides in healthy body. Physical health are interrelated with each other. Physical health and mental health, basically they mean, if a person is physically healthy, he will also become mentally healthy, because the mental health depends on physical health and vice versa. Therefore, good physical health is the first stepping stone to mental health. So basically, mental health means the ability of a person to build proper social relationships. Social relationship means as isme, there will be friendship, there will be any kind of special relationship, there will be relationship with your mother, with your father, with your parents, with your relatives. So each and every relationship, whether that person is being able to you know रिश्ते निभाना जिसको हम बोल रहे हैं, so basically that is defined as or basically that is the the scale to determine whether that person is mentally healthy or not. Okay, so basically the ability to build and to maintain social relationships. Okay, and not only maintain but also adjustment, because adjustment, whenever we are talking of any kind of relationship, whether it's a relationship with your partner, with your with your boyfriend, with your brother, with your sibling, with your mother, with your father, it is depend irrespective of what kind of relationship it is, in any kind of relationship we need to do adjustments. Okay, समझौता जिसको हम बोलते हैं वो करना पड़ता है. So that will also define whether that person is mentally healthy or not. Okay, and the most important, another most important thing that they are mentioning over here is that physical health and mental health, they are very much related, or they are very much linked with each other. Okay, so if a person is not physically healthy, then that person can never be mentally healthy. Okay, and the vice versa. If the person is not mentally healthy, then that person will not be able to be healthy physically. Okay, so physical health and mental health, they go hand in hand, they are complementary to each other. एक ठीक रहेगा तो दूसरा भी ठीक रहेगा, like that. Okay, moving forward, now what are the characteristics of a mentally healthy person? So number one, that person will feel satisfied, happy and cheerful. Number two, that person will be able to think for himself and take his own decision, means that person will be self sufficient and independent, or rather self dependent. He has firm determination and self control, means self esteem जिसको हम बोलते हैं, self esteem will be high. That person will be confident, self confidence रहेगा. Okay, and he is not dominated by stress, fear and anger. So stress, fear and anger, these are the typical negative emotions that we have. Okay, so those negative emotions should not surpass our positive emotions, or surpass our, or influence our day to day lives, or influence our day to day life decisions on a negative way. Okay, all of us, we suffer from negative emotions. Negative emotions will be there, they are there. That is why we can also immensely or strongly we can feel the positive emotions also, because we have felt the negative emotions also, isn't it? So negative emotion अगर नहीं रहेगा तो positive emotion को हम positive की तरह feel ही नहीं कर पाएंगे, isn't it? So negative emotions will be there, they has to be there, but they should not overplay us. They should not dominate us, or dominate our feelings, dominate our decisions. Okay, so that will be also a very important characteristic of a mentally healthy person. Okay, now coming to the third dimension of health, that is social health. So man, we all know man is a social animal. We cannot live alone, we cannot live on our own. Okay, we are, some way or the other we are dependent on others. Okay, so he cannot live individually, he have to depend on each other to fulfill his basic needs. He is not a family member only, but a member of the society, locality, city, country or the world. Cannot live alone मतलब ये नहीं कि मैं मम्मी पापा को छोड़ के अकेले रह रही हूँ. ओके, वो हम सब करते हैं किसी ना किसी टाइम पे, ड्यू टू आवर जॉब और ड्यू टू आवर स्टडीज. अकेले नहीं रह पाएंगे मतलब वी हैव टू इंटरैक्ट विद अदर पीपल फ्रॉम अदर बैकग्राउंड्स, फ्रॉम अदर प्रोफेशंस, फ्रॉम अदर कम्युनिटीज. ओके, बिकॉज वी नीड हेल्प ऑफ देम. अगर हम बीमार पड़ेंगे तो डॉक्टर के पास जाना पड़ेगा, डॉक्टर इज ऑल्सो ह्यूमन बीइंग. अगर हम कोई मुसीबत में पड़ेंगे देन वी नीड टू गो टू द पुलिस स्टेशन, वी नीड टू गो टू द लॉयर. सो दोज आर ऑल्सो अदर ह्यूमंस, isn't it? So we have to interact with them, we have to be in talking terms with them. Okay, that is what is meant by this. So problem of individual is considered as the problem of the area, city or country. Therefore, necessity arose for creating world organizations like we have WHO, World Health Organizations, then we have United Nations Organization. The health of the people depends primarily on the social and environmental conditions under which they live and work. Obviously, because if the environment just surrounding में हम जी रहे हैं, if that surrounding is very dirty, if that surrounding, if the sanitation of that particular region is not good, then obviously we will be suffering from more amount of diseases, isn't it? So हमारा जो society है, हम कौन से जगह में रह रहे हैं, हमारा environment कैसा है, हमारे आसपास कैसे लोग रह रहे हैं, that will also determine our health. Okay, so that will also be a determinant of our health. Okay. Economic tensions, poverty, unemployment, and adverse social relations greatly affect the health of an individual, particularly if we talk about unemployment and poverty. So, I will just highlight them because these are huge problems still now in our country. Okay, it's very unfortunate that we are till now, we are a poor developing country. We have not been able to become a developed country full fledged. But the like a very big reason or a very big factor behind that will be our exploding population. Okay, so as we all know that recently we have also surpassed China in terms of population density, isn't it? And let me remind you that the area of China as a country is much more than the area of India as a country. So despite of that, we have surpassed them in terms of population. So just imagine how densely populated we have become. So most of this population is illiterate, they are poor, they are below poverty line, and they are unemployed. And these are some highly determining factors, or these are some strong determining factors of our social health or our mental health rather. Okay, because these are the factors due to which a person can easily become depressed, a person can easily be suicidal in nature, a person can easily suffer from anxiety and frustration. Okay, and these are actually the reality of our country. Many of us actually do not know, we are not even aware that we are suffering from some kind of mental problem. Okay, custom and religious obligations affects the social health of an individual as well as community health. Again, religious beliefs, like there are many aspects of religious beliefs which can actually adversely affect the social health or the social the social relationships of a particular person. Okay, it is concerned with spirit or soul, and is that health which evokes the good spirits and right things and keeps away from bad activities. The body is guided by soul. If the spiritual health is sound, the bad thinking is always controlled by inner soul and the person hesitates to do bad events. So basically, spiritual health means where I am always thinking positive, I am not thinking of harming anyone else, I am not nurturing negative emotions or negative vibes inside me. That means that person is spiritually healthy. Okay, and if a person is continuously jealous of someone else, continuously brooding over some negative issues, some negative problems, then that means that person is not spiritually healthy. Okay, when the inner soul is overpowered by the mind, then inner voice does not come to guide the mind, thus he or she will not hesitate to do bad activities. All religions are concerned mainly about the spiritual welfare. It is a supernatural power that contributes to the health of an individual. Spiritual health is necessary to follow a set of rules and regulations in daily life. Say, for example, early to bed and early to rise makes a man healthy, wealthy, and wise. Okay, this is something we all know. To do prayers in the morning and evening a healthy sign of spiritual health. Okay. Now if we talk about the determinants of health. Okay, so let's see. Firstly, we have the individual factors. Individual factors में क्या क्या आएगा? Heredity and lifestyle. Secondly, if we talk about the environmental factors, उसमें क्या क्या आएगा? Socio-economic factors, political will, and availability of health services. And then lastly, we have other factors also. So let's first talk about the heredity. So the state of health of an individual depends on genetic characters received from which are received from parents. Okay, so heredity means what I am getting from my parents. Parents means my mother as well as from my father, because whatever genes we have inside our body, some of them are from mother, some of them are from our father. Okay, so whenever we are talking about health, हेल्थ का एक बड़ा हिस्सा आएगा फ्रॉम आवर मदर एंड फादर, विच इज हेरिडिटरी, which is something that we cannot control. Say for example, if both my parents are suffering from diabetes or high blood sugar, then there are high chances that at a point in my life, maybe right not from birth, but maybe at a point of time, I will be suffering from diabetes or sugar. So usme I cannot do anything. Obviously, if I follow a healthy lifestyle from my childhood, if I do regular physical exercise, and if I avoid high sugar containing foods, then obviously the chances will be reduced. But जो chance है वो रहेगा, isn't it? Because I have got their gene. Okay, so genes play a very important role in the health and development of a child. Many diseases are hereditary, like we have hemophilia, sickle cell anemia, hypertension, and diabetes. Okay. Now coming to lifestyle, again very important, something I've already talked about, that physically active lifestyle is very important, and also a healthy diet. So lifestyle of an individual plays a great role in health. It may promote and maintain good health, as it may adversely affect the health. मतलब वो health को सही भी कर सकता है, वो health को बिगड़ भी सकता है, depending on how the lifestyle is. If the lifestyle is good, if it's proper, then obviously it will promote good health. But if the lifestyle is bad, if it's sedentary, then it will obviously be promoting bad health, okay, or poor health. Lifestyle includes many personal activities like care of body, washing, care of teeth, hair, nails, and habits. If a person is having good habits, has better attitude towards others, he will enjoy physical, mental, social, and spiritual health. But if a person has bad habits, quarrels with others, and use alcohol, narcotics, or other drugs, he will be a problem to himself, community, and society. Now, this drugs part is again very important. Okay, when we talk about being physically healthy, or being both physically as well as mentally healthy, it's very important that the person is not suffering from any kind of substance abuse addiction. Okay, so उसमें अल्कोहल आ जाएगा, सिगरेट आ जाएगा, any type of drug addiction like marijuana हो सकता है, anything else, LSD हो सकता है. Okay, so that person should not be addicted to some substance. That person should not be practicing any type of substance abuse. So in that case, only we can say that the person is physically and mentally healthy. Okay. Okay, now coming to the third factor, that is socio-economic factors. So health of an individual depends on the socio-economic factors, which are governed by set of rules and regulations formed and accepted by the society. If they are financially sound, then there will be development in education, housing, social relations, and hygienic conditions. Property is the root cause of all, poverty is the root cause of all problems. Poor nutrition, illiteracy, slums, lack of business needs, etc. will lead to ill health. तो अगर if a person is not financially well off, if the person's socio-economic background is very poor, then that means उसमें एक तो there will be problem in finding a good job, and also that person will not be able to follow a good diet. Okay, as a result, he as well as his or her family, their children, will also be malnourished. They will not be getting a proper nutrition, and also not proper education. Okay, and that will also obviously eventually hamper the physical and the mental health. Okay. Next, we have political will. So, as discussed before, poverty is the root cause of all problem. If political decisions are taken and policies are framed, then within no time, all types of facilities like fresh water, pakka houses, pakka roads, electricity, educational and medical facilities are provided free of cost or reasonable cost, which will promote the health status of those living in the slum. So, basically, if there is, because it's something that should not be said, but again it's a very true thing to say, that most of the politicians in our country are corrupt, and they are stealing the money of the common people, of the poor people, and they are building big houses for themselves. They are using branded clothes, branded cars, and branded everything. They are flying with jet planes from here and there, from India to London, and then from London to wherever else. So these things, if they are stopped, and if we can provide free services, okay, free facilities, particularly to those who are in the BPL category, in the below poverty line, then obviously it can immensely improve the different health dimensions or health determinants of many people, particularly in countries like India, Pakistan, and Bangladesh, which are poor and developing countries still now. Okay. Next factor is availability of health services. So it will include adequate supply of safe drinking water, adequate supply of nutritious food, maternal child health care and family planning services. Because family planning services is again very important, because if family planning can be made understood to people, particularly those people who are illiterate, who do not have any idea about how to use these different contraceptive methods, then it can actually control our population explosion. Okay. And then we have preventive measures against diseases and immunization against infectious diseases like polio, tuberculosis, COVID, dengue, HIV, etc. Okay. Now coming to health indicators. So a health indicator is a measure designed to summarize the information about a given priority topic in population health or health system performance. Now what are the health indicators? First we have mortality indicators, then we have morbidity indicators, then we have healthcare services indicators, and lastly we have other indicators. Now talking about mortality indicators. Now what do you mean by mortality? Mortality is the death rate. Okay. So the rate of people that are dying in a particular area or a city or a country, that will be the mortality rate. Now there are some indicators which will be indicating the mortality rate. What are they? First we have the crude death rate, then we have the infant mortality rate, then we have the maternal mortality rate, then we have the life expectancy. And next talking about the morbidity indicators. Morbidity means the rate of suffering from a particular disease. It's coming from the word morbid. Morbid means being diseased or being ill. So the rate of people becoming ill or the rate of people becoming diseased with a particular disease, that will be the morbidity rate. And there are also indicators for morbidity, just like we had indicators for mortality. So what are the indicators for morbidity? First we have incidence rate and then we have prevalence rate. Incidence rate मतलब कितना disease हो रहा है, incident कितना है उसका, incidence कितना है, that is incidence rate. और prevalence rate मतलब how many people are actually suffering from that disease. Okay. And then we have healthcare services indicator like the doctor patient ratio, which is very much less in case of in countries like India. I hope we all know that, we all have got an idea about that when we suffered from or rather when we faced the COVID pandemic. Okay, in India, like around, if we talk about the government hospitals mainly, because the government hospitals are much more in number than the private hospitals till now. So there, for around 1,000 patients, we have only one doctor or two doctors. So we can understand that how less this ratio is. So we need to count the doctor patient ratio, we need to count the doctor nurse ratio, and also the population bed ratio, which is again also in a very bad condition. Okay. I think per 10 beds we have 50 patients or 60 patients. So again, that is a ratio which needs to be taken care of. Okay. So I think that's it. We will be soon moving on to the next important topic under this module of health and disease concepts. Till then, thank you and goodbye. Please stay tuned and please like, share and subscribe ITLS Academy.